Can you believe it? It has been 2 years since the world learned the term COVID long haulers. And not only do some people still have those crushing symptoms 2 years later, well, now they face an added challenge. With this story is our Cynthia Mulligan, who joins us live right now. Cynthia, good morning to you. And this is, first of all, when you look back to the calendar, 2 years since the WHO declared it a pandemic, 2 years since we've been in this lockdown, in and out of it. It is wild to think what we've all been through.
It's incredible. And it feels like it's been forever, but it's only been 2 years. I mean, it almost feels like it was last century that this happened, and we're still all kind of trying to wake up from this very bad dream. But for people, and we heard this fairly early on with the severity of the first wave, and there were many questions on how long will people be sick? And there were so many unknowns. And what we're finding out is, yes, the vast majority of people get past long COVID, and long COVID, by the way, it's defined as if you still have lingering symptoms 3 months later. But we know that there are a number of people that 2 years later, they still have symptoms. And I reached out to a couple of women. I've spoken to 4 for this story, but I've reached out to 2 that I spoke to in the first wave who, were so incredibly sick. And they tell me, yes, they're better, but you still hear the crushing fatigue, the COVID cough, the brain fog. That's a big one. One woman, Susie Golding, she believes she has brain damage. But to add all of this, so they can't go back to work full time. And we don't know how many are still impacted 2 months later and haven't fully recovered. But what we do know is there are some, and now they're starting to feel a real financial strain because they're losing their WSIB or their long-term disability. And here's what one woman, Deanne Labrie, told me the situation that she was in. And you have to remember, this is a woman who worked at her job as in a dental office and for 15 years never missed a day of work. And now she cannot work full time.
They will cut my benefits off, my medical benefits. Long-term disability is saying that unless there is a treatment plan, not rest in time, unless there isn't a real treatment plan in effect, they will not continue paying me as of April.
So she doesn't know what she's going to do financially. And it's taking such a toll mentally as well. And a lot of them talk about how they don't want to be left behind. As the world starts opening up, they don't want to be forgotten. And Mel, I was also speaking to a leading researcher, Dr. Angela Chung, and she's a leading scientist in this country. She's part of the biggest study group of long COVID in this country. It's a national study. And she was saying that the estimate is 10% of people who get COVID will get long COVID. So in Canada, that means out of 3 million people we have about 300,000. But that's the WHO estimate that it's 10%. Dr. Chung thinks it's closer, anywhere between 10 and 50. So it could be way, way higher than that.
It's interesting, Cyn, because I remember when, COVID was still new and people had these lingering symptoms. And I spoke to a number of long haulers, which we now know them as. And in the beginning, a lot of people didn't want to speak out because they thought, are these actual symptoms that are persisting? What is this? So there might be a lot of cases that have gone untreated, unknown. And so that could be very much an underestimate, right?
Definitely. I mean, it could be 500,000 people.
Wow.
But you don't know out of that 500,000 how many will still, like after 2 years, because some of them do start feeling better. So when we say long COVID, it doesn't mean it's 2 years out. It could mean it's 6 months and you start getting better. And these people are saying that they're getting better, but I slowly. But if they go back to work for 1 or 2 days, they're in bed for 3. So it's like 1 step forward, 3 steps back constantly. And they only have a limited amount of energy. And if they use it, they're in bed. Now, I did ask Dr. Angela Chung, do you think that these people will ever fully recover? And all she could say was, I hope so. Like, I really hope so. And they are trying to find what is causing people to not get through this, not fully recover, and find different strategies. I mean, one woman, Susie Golding, who started a huge Facebook group, she believes she has brain damage, a brain injury. And if you talk to her for a while, you see she really still 2 years later is struggling to find the words. So it's really tough for these people, physically, emotionally, financially.
Yeah, and that's an added stress, no doubt. And it's specifically to your guest that you'll play more of it on City News tonight. It's someone who has not missed a day of work, right?
Yeah.
For 15 years, and so
Yes.
that's a struggle.
That's a real struggle. And, there's pride and people enjoy their jobs and they get a sense of pride out of it. So it's all these different blows. And at 6, to your point, I do speak with a lawyer and get his advice on what these people can do.
And that's it. What are the options